It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
And hi again, everyone. Jim Knox along with Grace Sells. Welcome back to another edition of the Best Docs Network, featuring some of the best doctors in the entire Dallas-Fort Worth area that help change people's lives, like our first best doctor, Grace.
That's right, Jim. Now, up first on the show today, we're going to learn about the importance of skincare from facial plastic surgeon, Dr. Yadro Ducic.
So before I met Dr. Ducic, I just felt like my skin was dull and spotty and splotchy, and was constantly trying to search for makeups that would make a difference transitioning into my 50s.
Skincare is obviously very, very important. The skin is what everybody sees. They don't see the underlying bone. If we do somebody's rhinoplasty, they're not looking at their cartilages, they're not looking at their jaws, their cheekbones, their eye sockets. They see the skin. That's the first thing that you see. So ideally, you want the skin to look as good as possible.
Typically, Dr. Ducic does like me to see patients before they have surgery. He'll do a consultation and he'll send me in the room and say, please talk to them about skincare. Let's get their skin looking good first, and then we'll, discuss surgery.
I always feel at home with Jennifer. She is a very well-versed in skincare, and she pays attention to my age, and we stay really focused on what it is that I'm trying to accomplish.
Well, the whole point of doing cosmetic surgery on somebody is to make them look better and feel better about the way they look, and more comfortable in their own skin, so to speak. And so one of the first things we always try to do is tune up the skin, make the skin look as good as possible, because then people oftentimes are so happy with their skin that they don't feel like they need to sometimes even do surgery.
As you get older, your body you lose the collagen in your skin. Collagen's kind of like the springs in a mattress. You start to lose volume, and you'll start to notice fine lines and wrinkles. By stimulating the collagen, your skin will become firmer and the wrinkles will start to dissipate. There's several different things that we offer that help stimulate collagen, one of them being the Dermapen. It creates micro injuries to the skin, and when the skin starts to heal, it starts to rebuild collagen, which is pretty amazing.
And the goal is not to do surgery. The goal is just to make somebody look better.
I no longer have to search for makeups that cover up. I just feel younger than I thought I was going to feel in my 50s, and just feel brighter, and that my skin finally is at a place where it's glowing.
BestDocsNetwork.com helps you find the right doctor for your medical needs. Watch videos on each doctor and decide for yourself who fits you best. On the Best Docs Network homepage, you can see the latest videos, search for a doctor, find educational content, and watch the latest TV episodes from each BDN market.
I had gone from such an active lifestyle to a life of where sitting, standing, sleeping, trying to turn, trying to walk, getting up off the sofa was a major ordeal for me. Any kind of movement or non-movement was excruciating.
Brenda is in her 60s. She came to me because she had severe arthritis in both of her hips. She had seen other doctors. One doctor prescribed injections, but they only lasted a few days. So we found that she was indicated for bilateral hip replacement because she had severe arthritis in both hips.
After an examination, he goes, I have good news and I have bad news. And he says, well, the bad news is both of your hips are in really bad shape. He says, you're going to have the bilateral hip replacement. The good news is I can do it, and I'm happy to do it. Dr. Toulson also had a model of the hip, And he said, this is what the procedure's going to look like. And he talked through the whole thing, and he says, you're going to be a new person once you have these hips in.
It takes about 6 to 8 weeks for a patient to recover from hip replacement. But when you do both at the same time, it literally takes about the same amount of time for them to recover. This in particular makes bilateral hip replacement an ideal surgery when you have the perfect candidate. Because Brenda was very healthy, we were able to accomplish both hip replacements in one setting.
After surgery, I woke up and I cannot begin to tell you how wonderful it was. I was without the pain that I'd had over 2 years.
Brenda is doing amazingly well. She is just so happy and happy with life. She walks 3 to 4 miles a day. She has no pain. She's able to do everything she wants to do in her life, and we're extremely happy with her outcome.
I just cannot thank Dr. Toulson enough for giving me back my life. It's truly a gift, and I will be forever grateful.
Keeping your social networks alive and well may help benefit your ticker over the long term. Social support has been linked to a lower risk of heart disease, and people who do have heart attacks fare better if they are socially connected. To watch hundreds of videos on all the amazing doctors that you see on our show today, head to our website. It's bestdocsnetwork.com. Now up next, we're going to learn about the Aspen procedure and how it can help with breast hardening after having a breast augmentation. From plastic surgeon, Dr. Robert Wilcox.
When we do breast augmentation, one of the most common complications that we're trying to avoid is capsular contracture. And what that means is when you put in an artificial device in any person, whether it be a breast implant, a pacemaker, or an artificial joint, is the body makes a layer of tissue around it called a capsule. That happens in the first week, and that's the patient's own tissue. And that's a normal response. Unfortunately, in a minority of patients, that capsule can start to contract down and harden. So the breast implant, instead of resting on the chest like a dome shape, becomes rounded, pulls up, distorted, and can become painful. After breast augmentation, there are certain measures that are employed to try to prevent capsular contracture, and most commonly is to massage the breast implant daily. Nevertheless, probably about 20% of patients over the next 5 to 10 years are going to get that hardening. Now, traditionally, it's been taught that the only way to correct that is to go back into surgery and surgically remove that scar tissue and replace the implant. The Aspen after surgery actually gives us a non-operative measure to treat that. And what is involved is this: the impetus for that contracture or hardening seems to be bacteria, and it can be seeded from the breast because that's an open gland into the environment. It's the bacteria that's found on that capsule is normal bacteria found on the skin. But what happens is when it lands on that implant, it acts differently than bacteria elsewhere in the body and forms what's called a biofilm, like a shell around it, so that the antibiotics can't eradicate it. What the Aspen after surgery treatment does is an ultrasound device specially designed for the breast that imparts energy in to break up that biofilm so that the antibiotics we prescribe can then eradicate the infection and soften up the breast implant again. Now, when we see patients, the success rate of this depends on how severe the contracture is and how long they've had it. But in the typical patient that comes to us, if it hasn't been too long, if it isn't too far advanced, but it's distorted enough that they can see the distortion and feel the hardness, we get about an 80% response rate.
Coming up after the break, we'll learn the benefits of adding vitamin C to sunscreen. And then we'll see how Dr. Michael Thornton helped Janet with cosmetic revision surgery.
Do you have missing teeth, need crowns, veneers, partials, dentures, or a full mouth reconstruction? Prosthodontist Dr. David McFadden will give you back the youthful appearance and confidence you deserve. Backed by credibility and credentials, Dr. McFadden is cosmetically changing his patients' lives one smile at a time. Call today or log on to dignitydental.com. Dr. David McFadden, your go-to dentist in the Dallas-Fort Worth area.
Hi, I'm Dr. Yadro Ducic, Did you know that pairing vitamin C serum before you apply sunscreen can help protect your skin against the damaging effects of the sun? To learn more, watch my videos on bestdocsnetwork.com.
To find a doctor on bestdocsnetwork.com, you can search by your location and the doctor's specialty. From there, you can search through the doctors listed. You can even search by your current location to find the doctor closest to you.
I had augmentation done that went wrong. It was really, really bad. I was a fitness instructor and I've been teaching for a really long time, and I stopped because I was so cognizant of the humongous size that I had become, which is fine for those who go to get it. That's fine, but if it's not me, it's really messing with my psyche.
Janet came to see me because she needed some revisional cosmetic surgery. She had a particular breast deformity where it's called capsular contraction, which is basically the breasts are turning hard around the breast implants. And her breast implants were basically stuck all the way up inside her chest, and she had a lot of cleavage, and it looked very unnatural.
And I said, I can't continue this, Dr. I really didn't want to go under the knife again, but I think I have to because I can't continue to live like this. And his suggestion was, Janet, let's get rid of everything. Let's get you healed. Let your skin retract. And then, after a few months of that, let's go back in and do what you originally wanted done.
I had to do a couple of staged procedures for her because it's hard to do everything at once, and it's safer that way. If you try to rush surgery, especially revisional surgery, you can have problems. What I had to do is I had to first take out her implants. I had to do an explantation, okay? So that was the first stage, and do a mastopexy. So basically we took her breast and took them back to normal. After a series of several months later, when she healed up, I came back and I re-implanted some new implants, put them into a different place, and I did a tummy tuck on her and some liposuction. So it really made her look really good, and she is really happy today. It's a huge change and a huge difference. You can just tell that her overall personality's improved significantly.
It's been incredible since then. My life completely changed. I'm happy. I'm actually more confident, I think, than I've ever been, because I am the way I am. I'm out, and I'm actually thinking about going back into fitness. Dr. Thornton's changed my life significantly, and every time I see him, I tell him that. You're like my savior. You changed me. I am this happy 46-year-old woman that I owe him a lot.
Experts say weight training should be done first because it's a higher intensity exercise compared to cardio. Your body is better able to handle weight training early on in the workout because you're fresh and you have the energy you need to work out.
The two major groups of acne population that we see in our practice are teens, which is, I would say, about 60–70% of our acne patients are in their teens. And then about 30% of our acne patients are adult onset acne. These are people in their late 20s or 30s or even 40s.
My dream was to always become a model, and just dealing with acne, it's just like it affects me mentally, and it brought me my insecurity problems. And when I first met her at an event, she told me, it's okay, you're gonna feel beautiful one day. Whatever you feel right now, it's not gonna last for a long time.
Alexa is in the group of teen acne patients. She's had acne since her early teen years, and it's continued in her early 20s now. She has been treated in the past with multiple different types of skin treatments and medications as well. Typically what happens with her and most teens is that antibiotics or any topical acne product seems to work for a few weeks or a few months and it stops working. And that's the nature of acne, unfortunately. That's the nature of this condition. After patient evaluation and figuring out what type of acne they have, the treatment is tailored to address that particular patient's needs. In her case, we may use a combination of in-office procedures, antibiotics for a short period of time, and an anti-testosterone medication to reduce her testosterone sensitivity, and that's what has led to such great results with acne control in Alexa.
I felt like an ugly duckling, like people were gonna judge me and see me like, not as pretty, because nowadays it's all about image. You want to feel beautiful.
In my patients themselves, I see their personality change when their skin starts to improve. I mean, I've seen patients who are so shy that they avoid groups and crowds and they're antisocial almost, and their personality completely blooms when you improve their skin and appearance.
Today now, I feel a lot more confidence, and she's like done a wonderful job. I see a change, a big change now, especially from my before and after pictures. I feel like I can talk to anyone face to face. I feel accepted. I feel like a swan.
For more information and to watch hundreds of videos on the amazing doctors that you see on our show today, head to our website. It's bestdocsnetwork.com.
Now, Grace, we're going to head to our next best doctor. It is cosmetic dentist Dr. Guy Lewis, who helps Sandy regain confidence in her smile.
As I was aging, I guess, my teeth weren't as pretty as they used to be, so I found that I wasn't smiling as much as I used to.
You know, Sandy's a very beautiful lady. A lot of the patients I see, probably the majority of patients I see, are women, you know, over the age of 40, who a lot of times, you know, they take care of themselves, they stay in shape, they look great. But there's just some things they want to do to try to look younger. And for Sandy, you know, getting her teeth whiter, straightened up a little bit with the veneers was perfect for her.
I've seen a lot of Dr. Lewis's work and have been so impressed, so I came to see him. And I'm so glad I did, because now I smile all the time.
It just really works great for a lot of people, and she was a perfect candidate for that. It's amazing to me that doing the veneers like we did for her, which is a pretty simple 2-visit process, 2 or 3 weeks apart, what a difference it can make in how someone looks. I mean, and literally 10 or 15 years younger.
It's painless, it doesn't take long. Dr. Lewis is very sensitive to your feelings, how you want to look. He's a good listener. He listens to how I wanted my smile and my teeth to look, and he did exactly what I wanted.
It can be done so to where it's not like people look at you and go, wow, where'd you have your teeth done? But they look at you and go, man, you look great. You know, what have you done? Have you been working out more? Or you just look, for some people, if their teeth are really bad, yeah, it's going to be a noticeable change. But for other people, it's just one of those things to where you just look good, you look more alive, you look more refreshed, you just look better, but it's not just a glaring, oh, what'd you do to your teeth, you know?
My family would say, okay, what did you do? Something's different. Your smile is beautiful. Did you get your hair cut? I just feel so good about my smile now. Smiling's good. I'm not a big fan of going to the dentist, so this was a big deal for me, and I would do it again in a heartbeat.
Each doctor on the Best Docs Network website has their own profile page where you can watch videos on the doctor, read info on their background and training, find their office locations and directions, as well as ask the doctor a question and request an appointment.
Most everybody wants to know what is their ideal body weight. A lot of people use the BMI, body mass index. That's not quite as accurate as ideal body weight formulas because it doesn't take into account bony structure and muscular structure. The formula I use for my patients is this. I use a different formula for a man and a woman, and it's based on your height. For your first 5 feet of height, you get 106 pounds if you're a man and 103 pounds if you're a woman. For every inch of height above 5 feet that you have, as a man, you get 6 pounds, and as a woman, you get 3 more pounds, and then you get a number for your basic ideal body weight. Now, you add or subtract from that number based on bony structure. You sort of estimate as a physician or as a layperson whether this is a big bone person or a small bone person, and you either add or subtract 10%. This is a very accurate way to do it, and you can also add or subtract for high muscle mass. This will give you a pretty good ballpark figure for what you should weigh.
For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com and click on the Medical Minute tab on the home page.
Welcome back to the Best Docs Network. In the studio, we're pleased to be joined today by Dr. Harvey Carter, owner and founder of Carter Eye Center and one of the top cataract surgeons, not only in the Dallas-Fort Worth area, but in the country. Dr. Carter, thanks for being with us today.
Thank you for having me.
Now, you were the first doctor in the United States to perform the crystal lens procedure once it was approved by the FDA. Can you talk us through the procedure and how it works?
The crystal lens procedure is where you do a cataract implant operation, and cataract implant surgery is done with an implant lens where we replace the cataractous cloudy lens in the human eye with this implant lens. The crystal lens allows the patient to develop a wider range of vision after surgery because the lens is the only lens approved by the FDA to accommodate or focus in the human eye, which gives you the widest range of vision from near, far, intermediate in terms of a range of vision, allowing the patient to get some degree of spectacle freedom.
At what age do you normally see cataracts forming?
I'd say roughly 2 out of every 3 patients over the age of 60 have some degree of cataract development in their eye. The average age of the roughly 3.5 million or so patients who had surgery in the United States last year was probably around 72 years of age. So it's a painless, progressive, gradual loss of vision over about a decade or so is when patients start to notice it. The first signs and symptoms will be things like glare, halo, difficulty night driving, inability to see the television, different activities of daily living that'll just start to become impaired as you get into your 50s, 60s, 70s.
And do I understand correctly that you don't necessarily have to have a cataract to be a candidate?
Well, that is true. If you take and look at the operation, cataract implant surgery, which is where this came from, involved taking the cataract out and putting in this monofocal lens implant. And that's the most popular #1 procedure.
To see the rest of this interview, as well as other outstanding videos, head to bestdocsnetwork.com.
Stay tuned, because after the break, we'll see how Dr. David Azouz helped an aging divorcee get back into the dating scene and also learn the benefits of vitamin D.
Best Docs Network doctor and official eye doctor to the Dallas Cowboys, Dr. Harvey Carter, the expert for all your vision needs. See the world differently in only a day, specializing in LASIK, cataracts, and crystal lens. Visit Dr. Carter today for the ultimate eye experience. Call now and receive $2,000 off your LASIK procedure. When seeing is believing. Dr. Harvey Carter, the official eye doctor to the Dallas Cowboys.
Imagine designing your own perfect face and body. Turn to Dr. Robert Wilcox, who specializes in face and body procedures as well as many non-surgical alternatives. Dr. Wilcox understands that your life and appearance matter most. With an extensive educational background and exceptional eye for detail, you can now look as young as you feel. Call for a complimentary consultation and regain your confidence today.
For more information about any of the outstanding doctors you see on today's show, head to the website, bestdocsnetwork.com. That's bestdocsnetwork.com. Now it's time to head to our next best doctor. It is plastic surgeon Dr. David Azouz, who helped one individual get back in the dating scene with a younger look.
I never intended to have a facelift. However, I had married a gal for several years, and during those time I gave her lots of plastic surgeries. And then I found out that she had, after she left, she actually got remarried. And a fellow showed me her picture on Facebook, and she looked, at 55, she looked absolutely wonderful. Just really good. And I thought to myself, you know, if I could pay the money for the plastic surgeries for her, I bet you I have enough money to pay for it for myself.
John is a very intelligent gentleman who was close to 70 years of age, and he wanted facial rejuvenation surgery, but he wanted a very natural look. He didn't really want to necessarily look that much younger. He wanted to look rested, and he wanted to look good, and that's what he was after, which was very realistic for a gentleman who's close to 70 years of age.
It is unfortunate that more men do not choose to get a facelift because it makes a tremendous difference in their appearance. They get their chin back, they get all the wrinkles taken out of their face, and they look younger, and obviously they're going to have more respect when they're younger.
There's many actors and other prominent figures in our community where the males have had facelifts and they look like they've had a facelift. They have almost an unnatural look. In a gentleman, you have to be extremely careful because if you make him unnatural, you tend to feminize him. And I think the last thing a male wants is feminization of the face. They just want rejuvenation of the face. So I believe that we were able to achieve all that, yet giving him a very natural look to the point that he doesn't look like he's had facial rejuvenation surgery.
The surgery has given me a confidence to put myself on some of the dating services, the .coms, and the results have been excellent. I've probably had a different date at least once a week, maybe sometimes twice a week, and the number of people responding to me. I realized that they were younger and younger and younger, and typically the people that respond to me are aged somewhere between 50 and 55. And that's not bad for somebody 68. I'm very, very pleased with that.
BestDocsNetwork.com also has a video library of all the doctors' videos that you can break down by doctor, topic, and specialty. This is a great way to find videos quickly and watch all the videos associated with your needs. From food. Make sure your supplement delivers 400 IU of vitamin D, which is the dose that is said to reduce risk of early death by 7%.
When I first noticed I had some things off going on, I was experiencing a little bit of off balance and coordination wasn't the same. And I know my ability, and so I just knew something was off.
On CT and MRI, you could see a large cystic and solid tumor in the back part of the brain called the posterior fossa, which controls balance and agility.
Adam and I are young, we're in our late 20s. We're both very active. Adam coaches select soccer. I'm a club volleyball coach and also coach for high school. And we have a young daughter, Adley, who's 2.5. She's our first, and we've got one on the way due in May. So we have a lot going on, no time for a brain tumor really to come into our lives.
You know, I asked Dr. Cattorini, tell me something to make me feel more comfortable. And he said, you know how you coach soccer? I do this.
The tumor is benign. The tumor is quite large in terms of the cystic and solid component together, measured about 7 centimeters. A 7-centimeter brain tumor can grow very slowly, and so people's symptoms may be very minor and present then very suddenly.
Being young, you don't think anything like that's going to happen to you. So you're a little naive and think that you can conquer the world and you're invincible.
The treatment options for Adam were basically one, which is surgical. The focus on Adam's surgery was to remove the tumor completely so that there was no recurrence, and reconstructing the back of his skull because he wanted to go back to playing soccer as well as coaching soccer.
So it's great to get back out to the soccer field, practice sessions and games to see, my players.
Thanks to Dr. Cattorini, we have our lives back. We have our family back. I have my husband back and confident in his capabilities of just living life, doing his job, coaching, being active, being a part of our family. In essence, he gave us our normal life back.
That'll wrap up another edition of the Best Docs Network. Features some of the best doctors in the entire Dallas-Fort Worth area that help change people's lives. And for more information on any of these outstanding doctors, the place to go is bestdocsnetwork.com. That's bestdocsnetwork.com.
And if you have a question, a comment, or a life-changing story, we would love to hear from you. Just send us an email at info@bestdocsnetwork.com.
So long, everyone. We will see you next week.